So a very common question I get about dental implants is, what are they going to look like? How am I going to know what they look like? Are they going to look natural? Are they going to look like horse teeth? Or the guy from Friends, Ross. Ross got veneers one time and he had these big, bright, white, shiny teeth.
Ross, could you put up some of these flyers for me? No, Damon!
We can have them look natural if that's what you want them to look like. And that's kind of what I always like. It's kind of the most challenging way to do it, which I enjoy because I'm also not only a dental surgeon who does implants and restores complicated dentitions and stuff, but I'm also a cosmetic dentist. I do veneers, I do crowns. And so I look at everything through a cosmetic eye. If you want them to look natural, like most people do, especially my older guys, 40, 50, 60-year-old guys that are getting this done or older. They're not looking for a big smile change. They don't want it to be noticeable. They're not really caring so much about the look. They're more here for the function because they're missing eating steak and tired of having dental problems and stuff. But a lot of our female patients, they do want something a lot wider than what they have now. But with our process, we're able to let you kind of test drive the smile a little bit, I call it, with the way that we have our 3D temporaries that you get the same day that the implants are put in. And so you automatically get to try out the new smile at that time and decide, are you liking the color that you like, that we chose together at the smile design, which is the first visit of all this. Are you liking the smile, the color that you chose, the smile that I designed? I sit down and design the smile with a little bit of artificial intelligence that we use, some apps and stuff. It's pretty cool. But again, I just use kind of my eye of doing veneers and aesthetic dentistry and just my years of experience in doing this to design something that will fit your face appropriately, so that's kind of the big thing. That's how you don't get horse teeth. The teeth have to fit the face. They have to fit the smile. It's not like we just pick them out of a box and say, here's your teeth. We're gonna make them how you want them to look. And I say, beauty's in the eye of the beholder. I'm not gonna make you something that I think you're gonna like unless you really want my opinion the most or don't care. I'm gonna make what you think is gonna be good. And you may not know right away. That's why we do the temporaries, let you kind of test drive the smile, show your friends and family, your spouse, just walk around with them for a little bit, and you're not committed to anything right away as far as the look and design and color and everything. It's the best way I've found after years of doing this to make sure that there's no surprises with your smile. You're gonna get what you like and love. Really, that's kind of the main thing. I want you to absolutely love this. My goal at the end of this treatment is to be the hero. I want us to be hugging and high-fiving for days and weeks and months, down the road. And, I want you to absolutely love it because it's a game changer for people and it's something we're pretty happy that we can do, pretty passionate about it.